Good morning, everybody. We are going to start with this symposium. First of all, I would like to welcome all of you. Thank you very much for joining us to this Biotech Healthcare Symposium at the 43rd Congress of the ESCRS. First of all, I would like to thank Biotech Healthcare for their trust they have placed in me for moderating this session. And I would also like to thank our fellow panelists and speakers. I am very well accompanied. We have three speakers. Dr. Cabanás from Spain, head of the department of the University Hospital Virgen del Rocío in Sevilla. And two speakers from India, Dr. Ramamurthy and Dr. Ganesh. They are both leading names in the cataract and refractive surgery. And also we have two fellow panelists, Dr. Cancino, on my left. He is a leading cataract and refractive surgeon in Spain, and Dr. Geckel from Germany, another leading cataract and refractive surgeon. So we are going to start with the scientific program. We have three hot and nice topics with three great speakers. So I encourage all of you to engage with the speakers and the panelists at the end of each talk for doing 5-7 minutes of questions and answers. So first, I topic about acryl phakic IOLs, and I invite Dr. Cabanás to talk about a journey towards a universal Phakic calculator.
Good afternoon. Thank you so much to Biotech to invite me in this interesting meeting. We are going to talk about the new possibilities. We would like to check the efficiency of lens sizing formulas, not only precision, but also which formulas are really useful in daily practice, which ones help us the most. In SECOIR monograph 2024 lists 28 formulas. I will analyze 30, including Reinstein and Zanzibar's group. Many of them show right ESCRS values, so at the beginning sounds promising, but which is the trouble? Only between 1 and 3% of clinics have UVM with sulcus proofs. So without it, that means that many formulas cannot not be used. We lose about 50% of formulas. OCT is more common, okay, but results, you know, that are very a lot. Same patient with different OCT should have a different data. So, if we don't have an OCT like the Cassia 2 or a very new generation, we lose about 70% of that formulas. All right, let's see what we can make with the remaining of this 30%. If the OCT that you have, as in my case, is not a Visante, for example, I left only with 4 options. And if you don't have, like me, an MS39 or an Anterium, and use an OCT with anterior segment module, like Cirrus or Triton, you don't have any other option more than white-to-white based formulas. That was many of us end up using only OCOs. Doesn't it? So recently, there has been a growing buzz about the development of a new European calculator created by Biotech, Iberia plus colleagues. This is the focus of my talk today. What does offer it? This algorithm provides 19 optimized with measurements, white to white, angle to angle, scleral to scleral, sulcus to sulcus. 6 OCT devices, not only for this with measures, also optimized ciliary analysis, taking from angle-to-angle data, and examiner can check and correct it. And what are the key components for this formula? It has 6 ocular markers, 1 lens architecture marker, 6 different constants, 25 adjustments, and AI with machine learning that predicts bold even without ciliary. Last point is particularly relevant as the algorithms shows a loss for highly accurate estimations in most cases. However, in special situations such as relevant high or low ciliary, this prediction may not be as effective. Nevertheless, offers a very good accuracy in cases that fit standard parameters, correlating with factors such age, ametropy, keratometry, pachymetry, among others. Now I'm going to show you some examples of first studies, and we are going to talk about bold prediction tested with different devices like Cassia 2, MS39, or Scan2, or Quantel UVM. There is exactly a direct correction of sulcus R square of 0.45. But if we use it with the Biotech algorithm, it increases over 0.56. With Cassia, we have a very good relationship, but the most important thing is that we found is that when all available measures are used, that's it, 5 with measures combined with ciliary, the correlation reaches an R square of 0.8. This result is truly outstanding, as only Igarashi's study has reported a higher R square in the literature. Thanks to this, the calculator can generate a 6 integrated sizing calculation, combining all measurements to optimize the precision of the final result. Based only, in this case, in 36 eyes, we can see like more than 95% of the eyes are between 300 microns of predicted bold, 80% between 200 and more than 50% between 100. This puts the algorithm in the top 2 worldwide for 100 microns prediction. In fact, it will rank in our case very high. We'll have to see if we can maintain such results once the sample size increases significantly. Both, if we compare prediction with Cassia 2 or MS39, both are good for ciliary measures. Manual ciliary check improves accuracy a lot, and MS39 needs manual adjustment to work better. Here in this graph, you can see in green, real bold blue, MS39 prediction. In green, Cassia 2 prediction, and in green, real bold. In blue, MS39, and in green Cassia 2 prediction. These lines illustrate the great support guidance for our patients we can obtain using this calculator. In this other group of patients, we can observe the correlation in the initial validation series. Early data with Bisante ciliary and 4 parameters are already gave a R square over 0.5 again. And if we look the group of analysis, we see, again, a very good result according to the one we showed before. Even with all devices, Biotech rank is in the top 3 worldwide predictor. In this slide, we confirm that using many rhythm measures give much better accuracy than using only one. And finally, I would like to show you my preliminary results in my short experience, only 18 eyes, but I have very good results. These are the preoperative and surgery data of these patients. We don't find significant difference before and after surgery about pressure, intraocular pressure or endothelial damage. So the procedure, we can say at the moment that is safe and stable. Also, the sample size is small, like I told. The refractive outcomes I have obtained so far are excellent, with a mean spherical equivalent of 0.05 diopters at 2 months. In addition, 85% of the patients are within more or less 0.25 diopters, and 100% are within 0.75. Regarding bold prediction using artificial intelligence, we observe that the calculator provides an efficient guidance, less accurate when ciliary is very high or very low, like we said before. Best to measure ciliary pre-op to avoid it. Calculator helps choose lens size. For example, we can change, in one case we change from 12.5 to 12. Bold predictor, because bold predictor show that we were going to have a low bold, and it was correct once again. So, in summary, to take home messages, I can say that the European Biotech algorithm integrates multiple biometric parameters. Combining multiple measures significantly increase bold calculation accuracy. The algorithm can detect and flag measurements errors. Refractive outcomes, IOP or ACD, demonstrate safety and stability postoperatively. This approach places the algorithm among the top performing methods worldwide, even without next generation OCT systems, which is very important. It represents a key advancement in predictability and standardization for Phakic IOLs sizing. Thank you so much.